What if your dog's eyes have been trying to tell you something, and you've been calling it just a little irritation? Red eyes in dogs are one of the most common reasons owners search the internet at midnight, worried, scrolling through photos trying to compare them to their own dog's eyes. Sometimes it's nothing serious, and sometimes red eyes are the first visible sign of a problem that needs attention within hours, not days. The tricky part is telling the difference. Today, we're breaking down 8 possible reasons your dog's eyes might look red, what each one may involve, and, most importantly, how to know when it's time to call your vet. Why this matters. Dogs are remarkably good at hiding discomfort. It's an instinct left over from their wild ancestors. In nature, showing weakness could make you a target. So by the time you notice something is visibly wrong, your dog may have already been dealing with it for a while. Eyes are especially important to pay attention to because some causes of redness are mild and resolve on their own, while others, left unaddressed, can affect your dog's vision permanently within a matter of hours. The good news? Most eye conditions, when caught early, respond very well to veterinary care. This isn't about creating panic. It's about giving you the knowledge to notice and the confidence to act. Let's get into it. Cause number 1, allergies. Meet Max, a 4-year-old Labrador who spends his afternoons rolling around in the backyard grass. One spring morning, his owner noticed both of his eyes looked pink and watery, and he'd been pawing at his face more than usual. Veterinary explanation. Just like people, dogs can react to allergens in their environment: pollen, dust, mold, or even certain grasses. When the immune system reacts to these triggers, it can cause inflammation in the thin, delicate tissue covering the eye, called the conjunctiva. This is what gives the eye that pink or red appearance. Possible causes. This symptom may be associated with seasonal allergens, contact irritants, or sensitivities that build up over time. It tends to affect both eyes rather than just one. What owners should watch for. Watery discharge, mild swelling around the eyes, sneezing, itchy skin, or excessive paw licking alongside the redness. When to see a veterinarian. If the redness is mild and your dog seems otherwise comfortable, it's reasonable to monitor for a day. If it persists, worsens, or is paired with swelling or thick discharge, a veterinary visit is recommended to rule out other causes. Prevention tip. Rinsing your dog's face with clean water after time outdoors during high pollen seasons can help reduce allergen buildup around the eyes. Cause number 2, conjunctivitis. Daisy, a 7-year-old beagle mix, came into the clinic with one eye noticeably redder than the other, along with a yellowish discharge crusted along her lash line. Veterinary explanation. Conjunctivitis simply means inflammation of the conjunctiva, that same pink tissue we mentioned earlier. It can happen for many reasons, and the appearance can offer clues. Clear discharge often points toward irritation or allergies, while thicker colored discharge may suggest an infection. Possible causes. This symptom may be associated with bacterial or viral infection, environmental irritants, or an underlying issue elsewhere in the eye. What owners should watch for. Squinting, discharge changing color or thickness, swelling of the eyelids, or your dog rubbing the face against furniture or carpet. When to see a veterinarian. Because conjunctivitis can sometimes be a symptom of something happening deeper in the eye, a veterinary exam is recommended, particularly if only one eye is affected or discharge is thick and colored. Prevention tip. Keep the hair around your dog's eyes trimmed if your breed is prone to hair irritating the eye surface, and avoid exposing your dog to smoke or strong household chemical fumes. Cause number 3, dry eye, keratoconjunctivitis sicca. Rocky, an 8-year-old Cocker Spaniel, had eyes that looked red and slightly dull, with a thick, mucus-like discharge his owner described as gunky every morning. Veterinary explanation. Tears do more than keep the eyes comfortable. They nourish and protect the surface of the eye. In dry eye, the glands that produce tears don't make enough of them. Without that natural moisture, the eye's surface becomes irritated, red, and vulnerable to further damage. Possible causes. This symptom may be associated with an immune-mediated process affecting the tear glands, certain medications, or breed predisposition. Some breeds are simply more prone to this condition than others. What owners should watch for. Thick, sticky discharge, a dull or cloudy appearance to the eye surface, frequent blinking, or visible discomfort. When to see a veterinarian. Dry eye is a condition that tends to worsen without management, so a veterinary evaluation is recommended as soon as these signs are noticed, rather than waiting. Prevention tip. Routine wellness exams can catch early tear production changes before they progress, especially in breeds known to be predisposed. Cause number 4, Corneal injury. Luna, a playful 2-year-old border collie, came home from a hike squinting hard, with one eye watering heavily and noticeably red. Veterinary explanation. The cornea is the clear protective outer layer of the eye. Think of it like a windshield. A scratch, poke, or piece of debris can injure this surface, and because it's packed with nerve endings, even a small injury can be quite painful and cause redness as the body rushes blood flow to the area to begin healing. Possible causes. This symptom may be associated with a scratch from a plant, another animal, rough play, or a foreign object making contact with the eye. D. What owners should watch for: squinting, pawing at the eye, excessive tearing, or keeping the eye held partially or fully closed. When to see a veterinarian. Suspected corneal injuries should be evaluated promptly. Attempting to wait it out can allow the injury to worsen, and some corneal wounds can progress quickly. Prevention tip. Be mindful of tall grass, thorny plants, and rough play near the face. These are common, everyday sources of corneal injury. Cause number 5. Glaucoma. Charlie, a 10-year-old Cocker Spaniel, seemed to squint one afternoon, and by evening his owner noticed the white part of his eye had turned strikingly red, and the eye itself looked slightly larger than the other. Veterinary explanation. Inside the eye is a small amount of fluid that helps maintain its shape and pressure. In glaucoma, this fluid doesn't drain properly, causing pressure to build up inside the eye. That rising pressure is painful and can damage the optic nerve, the structure responsible for vision, surprisingly fast. Possible causes. This symptom may be associated with a primary drainage abnormality in the eye, or it may develop secondary to other eye conditions like inflammation or injury. What owners should watch for: a cloudy or bluish appearance to the eye, one eye appearing larger, visible pain such as pawing at the face, or sudden behavioral changes suggesting vision loss. This is a potential emergency. Glaucoma is one of the true time-sensitive eye conditions. Pressure that isn't addressed quickly can lead to permanent vision loss within hours. If glaucoma is suspected, seek veterinary care immediately. Prevention tip. Breeds known to be predisposed to glaucoma benefit from routine eye pressure checks during wellness visits, allowing early changes to be caught before a crisis develops. Cause number 6. Uveitis. Bailey, a 6-year-old mixed breed, had an eye that looked deeply red, almost bloodshot, with a slightly cloudy tint, and she seemed unusually sensitive to bright light. Veterinary explanation. Uveitis refers to inflammation of the structures inside the eye, rather than just the surface. Because this inflammation happens deeper within the eye, it often causes more pronounced redness and can be a sign that something else is going on in the body. Possible causes. This symptom may be associated with infections, immune system responses, trauma, or less commonly, underlying systemic disease elsewhere in the body. What owners should watch for: cloudiness inside the eye, sensitivity to light, squinting, or a change in the color or clarity of the colored part of the eye. When to see a veterinarian. Because uveitis can sometimes point to a broader health issue, prompt veterinary evaluation is recommended whenever these signs appear. Prevention tip. Routine parasite prevention and vaccination schedules help reduce the risk of some of the infectious triggers linked to uveitis. If you're finding this information helpful, let me know in the comments what kind of pet you have. I love hearing about your companions. Cause number 7. Cherry eye. Bruno, a 1-year-old bulldog, developed a strange, pink, fleshy bump in the corner of his eye almost overnight. The surrounding area looked red and irritated. Veterinary explanation. Dogs have a third eyelid tucked in the corner of the eye that contains a small tear-producing gland. In some dogs, this gland can shift out of position and become visible as a swollen, reddish-pink mass, commonly nicknamed cherry eye. Possible causes. This symptom may be associated with a weakness in the tissue that normally holds the gland in place, and it's seen more frequently in certain breeds, including bulldogs, beagles, and Cocker Spaniels. What owners should watch for: a visible pink or red mass in the inner corner of the eye, rubbing at the face, or excessive tearing. When to see a veterinarian. This condition doesn't typically resolve on its own, and is generally recommended to be evaluated soon after it's noticed, since prompt care tends to lead to better outcomes for the gland's long-term function. Prevention tip. There's no guaranteed way to prevent cherry eye, but knowing whether your breed is predisposed can help you recognize it quickly if it happens. Cause number 8. Foreign body or irritant exposure. Coco, a curious 5-year-old terrier mix, had been digging in the yard and came inside with a red, watery eye and noticeable discomfort. Veterinary explanation. Small particles like dirt, sand, grass seeds, or even household cleaning fumes can irritate or become lodged against the surface of the eye. The body responds with redness, tearing, and inflammation as it tries to protect and flush out the irritant. Possible causes. This symptom may be associated with outdoor debris, dust, chemical fumes, or a foreign object trapped under the eyelid. What owners should watch for. Sudden onset of redness after outdoor activity, persistent pawing at one eye, visible squinting, or excessive blinking. When to see a veterinarian. If redness and discomfort don't improve shortly after your dog is away from the irritant, or if you suspect something is lodged in the eye, veterinary evaluation is recommended. Attempting to remove an object yourself can risk further injury. Prevention tip. Avoid letting your dog stick their head out of a moving car window, and be cautious in tall grass, dusty areas, and around recently used cleaning products when this becomes an emergency. While many causes of red eyes are manageable with routine veterinary care, certain signs mean you should seek emergency attention right away. Difficulty breathing, collapse, repeated vomiting, seizures, suspected poison ingestion, inability to urinate, severe bleeding, a visibly bloated abdomen, loss of consciousness. Any of these, especially alongside eye changes, suggest your dog's body may be dealing with something serious beyond the eye itself. In these situations, time matters. Please don't wait to see if things improve on their own. Contact your veterinarian or nearest emergency animal hospital immediately. Let's bring it all together. Red eyes in dogs can come from something as simple as seasonal allergies or from something more urgent like glaucoma or a corneal injury. The redness itself isn't the full story. It's the surrounding clues that matter most. Is one eye affected or both? Is there discharge, and what does it look like? Is your dog squinting, pawing, or avoiding light? Has the eye changed shape or clarity? None of us expect to become eye specialists overnight, and that's not the goal here. The goal is simply to notice when something looks different, and to trust that instinct enough to get it checked. The goal isn't to worry you, it's to help you recognize when your pet may need extra attention. The earlier problems are recognized, the better the chances of keeping our pets healthy, comfortable, and by our side for years to come. If you enjoy veterinarian-approved pet health education, subscribe for new videos every week. Together, we can help our pets live longer, healthier lives. This video is intended for educational purposes only and is not a substitute for an examination by a licensed veterinarian. If your pet is sick, injured, or experiencing an emergency, contact your veterinarian or the nearest emergency animal hospital immediately.